According to CMS, in 2015, we spent over $3.2 trillion on healthcare in the U.S. Publicly funded programs such as Medicare, Medicaid, and others account for more than 2/3 of that spending. This amounts to nearly 20% of our total GDP, or $10,000 a person per year. Yet we have 87 million people who are uninsured or underinsured. Bernie has proposed policies that, when implemented, can raise the necessary funds to guarantee healthcare to every man, woman, and child in this country. Through years of manipulation, our tax laws have been corrupted to serve the wealthy at the expense of all. But in a society that seeks to acknowledge human rights and freedoms, a public-spirited tax system is pivotal to the success of social programs that ensure, safeguard, and pursue those rights. It is only through the implementation of a more progressive marginal tax system that we can achieve a more just society for all our people. This system of taxation aims to fairly tax people based off their amount of earnings. FDR once said, "Taxation according to income is the most effective instrument yet devised to obtain just contribution from those best able to bear it, and to avoid placing erroneous burdens upon the masses of our people." Additionally, as it currently stands, huge sums of money avoid both a necessary and fair tax. These include taxes on capital gains, which are the profits made from sales of assets such as land, shares of stock, and businesses, and dividends, which are the shares of profits given by companies to their shareholders. Current tax laws are designed by the rich for the rich, and under Bernie's plan, these tax breaks on capital gains and dividends would be eliminated for households with an income above $250,000. The federal estate tax is a tax collected on the transfer of a person's assets to their beneficiaries after death. Today, a 40% estate tax only applies to the wealthiest 0.2% of Americans, with an exemption made on the first 11.4 million in their assets. Bernie would create a marginal tax system and lower the exemption level to a more reasonable $3.5 million a person, which would generate $24.9 billion a year. Currently, the wealthiest 0.1% own almost as much wealth as the bottom 90% of Americans. Under this option, a 1% tax would be applied to the net worth exceeding $21 million for a household. That means a household with $21.5 million would pay 1% of $500,000, or $5,000. This will raise $130 billion a year. So this is mom, dad, girl, and boy. They're currently paying $5,277 per year for their private health insurance card. In the event they require healthcare, they will have to pay out of pocket until they reach their deductible, which is on average $9,000. This is about $14,000 per year, and the reason for an estimated 500,000 bankruptcies. Bernie would implement a 4% income-based premium, which would reduce their cost from about $5,000 a year to $800, as private premiums, deductibles, and copays would be obsolete. Households with an income below $29,000 would be exempt from this tax, and this option would raise $350 billion a year, while acknowledging healthcare as a civilized human right. Now imagine mom's employer is providing the insurance for our family. Currently, it costs them $12,875 a year. Bernie would implement a 7.5% payroll tax that would lower their costs to $3,750 a year, save them $9,000 per person covered, and raise $350 billion a year to fund universal health care. In order to protect small businesses and lower their costs, all employers' first $2 million in earnings would be exempt from this tax. Through offshore tax havens such as the Cayman Islands, Switzerland, Ireland, and many more, corporations have evaded taxes on $2.6 trillion. Bernie would impose a one-time tax on these profits, generating $766 billion over a 10-year period. Today, the 6 largest financial institutions hold about $10 trillion in assets. Bernie would implement a 0.07% tax on institutions with $50 billion or more in total assets, which would generate $11.7 billion a year. LIFO is this absurd inventory evaluation method, which assumes that the last items placed in an inventory are the first sold in an accounting year. And through this method, American companies reduce their reported level of profitability to decrease their owed income taxes. For more information on just how this happens, refer to the link in the description. Bernie would repeal this manipulative practice, which is currently banned throughout the world, raising $11.2 billion a year. To recap, Bernie's plan to finance Medicare for all can be broken down into three broad categories. How will I be affected? The average citizen and my business. The implementation of a 4% income-based premium paid by households, which would replace all other healthcare costs that you currently pay, including your private health insurance premiums, deductibles, and copays. A 7.5% income-based premium paid by employers, granting you the freedom to move within the workforce without fear of losing your right to life-saving treatment, while saving most businesses huge sums of money. Savings from eliminating the fiscally irresponsible health tax expenditure, which currently stand to divert hundreds of billions of dollars from your pockets to the hands of the wealthy. How will I be affected? The wealthy. You will see an increase in your owed income and state taxes through a more progressive and fair marginal tax system. You will pay an additional wealth tax if you are currently within the top 0.1% of the population. You can no longer take advantage of the Gingrich-Edwards loophole if you are currently a wealthy business owner with an established S corporation. How will corporations and Wall Street be affected? They will no longer be incentivized to hold their profits offshore and out of circulation, and a one-time tax will be imposed on their current holdings. A fee will be imposed on large financial institutions, and they will no longer be able to take advantage of this deliberately manipulative accounting method, which is LIFO. Together, this will raise an estimated $1,579,200,000 a year, which is exceeding the $1.2 trillion required to finance Medicare for all.